How can I conceive easily? So this is what we'll be looking into, because sometimes when we want to get pregnant, we just jump into it. If you jump into it and at the middle of it you start having problem, or you find out that you are not conceiving, you are not getting pregnant, you become worried. That is when stress will come from nowhere, problem will start occurring. But all these things I'm going to be saying here, if you do them before you plan to conceive, you will not have problem. Believe me, because when you are doing all these things, you are going to find out whether you have problem or not. But if you don't do them and you just jump into it, you discover at the middle that you have these problems, then that is when another stressful problem will start. Now, before you start planning to conceive, the whites, one thing I like about them is this: before they start planning to get pregnant, they prepare it, because they know that it is a journey. They prepare every aspect of it. That's fine. That was my yes. Okay, Mercy. Okay, Mercy, you are the one that you need to answer. You need to pay attention now. You say you want to get pregnant fast or easy. You need to do all these things I'm going to be talking about here. And if there's anybody out there that is planning to get pregnant, you need to follow this step, do it, and you will see that you will not have problem in getting pregnant, except in a situation where you already have problems. If you have problems already, then during this period, you are going to find out whether you have problem. But if you don't do all these things, this is the problem. Most of the women, for example, somebody who is planning to conceive now, you are both 35. People under the age of 20, they at times they skip this. It doesn't affect them because they are still young. Their hormones or their body is still intact. They are still very much healthy. That's why they can. But once you enter 35 years and you want to become pregnant, you need to do all these things to fasten it, to avoid problems. So the number one thing that you need to do before planning to get pregnant, one, you have to go for a medical checkup. I repeat, go for a medical checkup. What do I mean by medical checkup? It's not going to the hospital. You need to visit your gynecologist, healthcare provider, fertility doctors. You need to visit them. When you visit them, they are going to check you. They are going to check your womb. They are going to check your hormones. They are going to check everything. Then during this check, I am sorry for those in Nigeria, because these things, would I say it's not applicable, or if it is applicable, it costs a whole lot of money. But those of us in Europe, Western world, please, this is necessary. You can remember sometimes when you go to your gynecologist here, they call it Frauenarzt, and he will take you through ultrasound, what is called ultrasound. So in that ultrasound, what is he checking? First of all, there is something that he will use to, he will shook into your uterus, to check if there is one. The first thing he's doing, there's three things they will do if you are not observant. The first one, he will put on glove and take something like a cotton board, use iron to open your bum bum. I don't want to use that harsh word. And they put that inside, take it. In our side, you people call it culture test. But the doctor will take it. That first thing he's doing, he's checking if you have any form of infection. So he will check it. After that, then he will use the ultrasound here. He will check your womb again, check everything in your system. So during this test of ultrasound, what do you know what he's checking? He's checking if you are releasing egg. He's checking if you have cysts or if you have fibroid. He's checking everything. So in this process, if he notice anything, he's going to tell you, oh, you have infection. Either you have sexually transmitted infection, or you have fibroid, or you have cyst that needs to be taken care of before you start planning to get pregnant. But if you have done this and they tell you there is no problem, then you can go ahead. I repeat, the first thing you are supposed to do is to visit your gynecologist, healthcare provider, fertility doctor, anyone that is taking care of you. Let them check you thoroughly. Do hormonal test. Some doctors may not recommend you. They will just check your uterus and check everything, infection, and ask you to go. But then you still have a problem. So as you are doing this, ask them to do or conduct a hormonal test on you. So in that hormonal test, they are going to check your estrogen, they are going to check your progesterone, they are going to check your prolactin, they are going to check your thyroid gland. Please, if you are joining us, like, share. I want to see 100 share of this program. Please share, like, follow the page. This page, they grow at all, but people, they watch my video. I'm surprised if I make video like this, before tomorrow you see 10,000 people, but they cannot follow. It's not good. You are learning, you follow the page so that anytime I upload or I'm live like this, you come and learn. So they are going to do this for test: progesterone, prolactin, estrogen, and thyroid gland. These are the men hormones that take care of pregnancy, ovulation, implantation, and development of the fetus. So when they conduct this test, in this process, sometimes they may find out that one of your hormones is not balanced. Maybe you have a prolactin problem. If you're having prolactin problem, it's likely that you are not ovulating. If you have thyroid problem, you might not be ovulating. If you have a progesterone is works in the area of implantation. After the egg is being relieved, then it is the duty of the progesterone to go and thicken the lining of the uterus for a successful implantation. And again, estrogen also. So when they conduct this test and they find out that either your progesterone or your estrogen level or your thyroid gland, either you have hypo or hyperthyroid, then they will provide a solution for you, give you medication, place you under medication. You will take it and everything will be. You see, now you are saving yourself the stress. When you do all these things, after doing all these things, then you can become pregnant. And when you become pregnant, hormonal test, then after the hormonal test, the next thing you are going to do is you take prenatal vitamins. Prenatal vitamins are very, very important. It's very, very important when you are trying to conceive. You need to take it up to 3 months before you start planning to conceive. Now, what is this prenatal vitamins? These are supplements that contains daily vitamins and minerals you need before and during your pregnancy. It is advised that you take before planning to conceive. Take 400 milligrams of folic acid every day for at least 1 month before and during pregnancy, as it can help spinal cord of the baby. So it's very, very advisable. I don't know if my internet is still working. I don't know. Can you people hear me? Can you hear me? Can you hear me? Please, if you can hear me, let me know. If you can hear me, let me know. I don't know, my internet is not good. Or maybe if you cannot see it later, you watch the video. I don't know, my internet just strip off. So the first thing I said, you need to visit your doctor. Okay, Star, thank you. I said the first thing you need to do if you want to get pregnant easily, you need to go for medical checkup, visit your gynecologist, visit your healthcare provider, visit your fertility doctor. The second thing is you take your prenatal vitamins. You take your prenatal vitamins. It's very, very important. Take it a month to 3 months. You take 400 milligram, but in most cases, you can take up to 800 milligram because it's a high dosage. Sometimes, some people, when they take 400 milligram, it doesn't work in their system until they increase it to 800 milligram. So you take it is very, very important. It helps in the baby's development. It helps you to avoid, miscarriage. It helps to prepare your womb. So it is very, very important. The 3 things that you need to do is you should know your fertile days. This one is very, very important when it comes to getting pregnant. If you are joining me, please like this program. I'm not seeing likes here. Like the program, share it, please. So, you know your fertile days. It is very, very important. And what I mean by fertile days, know your ovulation. If you go through this page, you will see that I have made a video about ovulation up to, let me not exaggerate, 4 or 5. And yet people are still asking. If you don't understand, you can go back to the video and watch it. That's why anytime I'm doing video about ovulation, I always like it, to make it when I'm sitting down, and I will give the details. So, ovulation is the release of egg from the ovaries. In human, this event occurs when the ovary follicles ruptured and release. The many women who do not know how to calculate their ovulation, this is where the problem lies. If you don't know your fertile days, he said, if Oluwa, I don't ovulate, now what can you recommend? If Oluwa, you know, if you are not ovulating, there must be causes to it. You need to go and find out the cause of you not ovulating. Okay, I may ask you to go and take this now, and if you take it, it will not work because the cause of that ovulation is not known. So, Oluwa, what you would do for me now is that you should go. Are you on a pill? Are you taking any pill? Oluwa, what you will do now, you have to go and do hormonal test because that could be the problem. If you are not under stress, sometimes stress can make you not to ovulate. Go and do hormonal test. Just go to any lab, ask them to do you hormonal test. Then after the test, you will know what you are suffering from, what is preventing you from not ovulating. Because I cannot tell you to go and do this, and after doing it, it will not work. You have to cure a sickness or ailment. You need to start from the root causes of it. So we need to know why you are not ovulating. What is that hormones that is preventing you? Yes, if you are not in any pill, then you need to go and do hormonal test and to find out your hormones that is not working. Do you have PCOS? Are you suffering from PCOS or endometriosis? Do you have all these things? These are the things that could make you not to ovulate. If you are not suffering from PCOS, you don't have endometriosis, and then you need to go for hormonal test. So, ovulation happens about 14 days before your period starts. For people who do not know, if you have 28-day cycle, always count out the 14th day. Only 14th day is the day that you are supposed to ovulate. I have my hormonal result. Okay, what is the hormonal result? You have multiple fibroid. Multiple fibroid, how meters long, how big is the fibroid? How big is the fibroid? Is it large? Is it up to 5 or 6 centimeter? How big is the fibroid? So ovulation happens about 14 days before your period starts. If your average menstrual cycle is 28 days, you are likely to ovulate around day 14. And your most fertile days are 12, 13, and 14. If your average menstrual cycle is 35 days, ovulation happens around day 21, and your most fertile days are 19th, 20, and 21. If your average cycle is 21 days cycle, you are likely to ovulate on the day 7. Your most fertile days are 5, 6, and 7. I don't know if anybody understand. Oh, it's big. 9 centimeter is big. So, do you know the position is located? 9 centimeter is big. This is the type that needs to be removed. Do you know the position? Which position? If which position is the fibroid? Is it inside or outside the womb? You know, I want to correct this impression, especially from people in our side. We always believe that when you undergo fibroid surgery, that after it you are not going to get pregnant again. It's a lie. It's a lie. At times we use unimaginable things to discourage others. In fact, if your fibroid is big like this, the best thing to do is to go and remove it. Except if the hospital that is carrying out this thing, they are not, how will I put it? They don't know how to do it. That is while it always require results in that. But here, I have seen a lot of people who undergo surgery, fibroid operation. Immediately they remove it. Next 2 months they have conceived. But in our own side, I don't know how qualified and how good they are in removing it. But with a 9 centimeter is big, is something that needs to be removed. But if it is, when you become pregnant with it, if it is inside the womb, if you become pregnant with it, as your baby is growing, the fibroid is growing, at a point it will lead to miscarriage. And believe me, if you are pregnant with fibroid, it's not a good experience, because you are going to live with pains, depending on the location. If it is outside your womb, you don't have problem. You will not experience a lot of pains. But if it is inside the womb together with the baby, my dear, it's just grace of God that will help you to survive with that kind of pregnancy. So if you have to find out where it is. If it is inside, I will encourage you to go and remove it. Or if you want to do some home remedies to treat it, you can treat it, but I will not lie to you. So I don't know if anybody have question, because I want to stop. I have finished treating this topic, and I believe the person who asked this question have grabbed 1 or 2 things. Do anybody have question? Please do not hesitate to ask me. Any question? Please, if you have a question, ask me before I go off. Okay, since there is no question, we are going to stop here today. Maybe tomorrow we'll continue. My internet is disturbing. I hope you heard what I said. You have to find out where the fibroid is located, and yes, find out where it's located. If it is outside, you don't have much problem. If it is inside, I think you need to do something. It's not going to stop you from getting pregnant. You can get pregnant, but it's going to affect you throughout the pregnancy. Thank you so much.